Welcome to the Surgery and Therapy Summit interview with Yesenia. Yesenia has been an occupational therapist for 6 years, and she has worked predominantly in hands and has a special interest in treating patients with stiff hands. And so she is going to be on our stiff hand panel, as well as doing a presentation on complex trauma with the stiff hand. Yesenia, welcome to the summit.
Hi, thank you for having me.
So tell us a little bit about you. What made you want to become an OT and specifically, work within the hand therapy field?
So when I was in college, I was actually working for a CHT, but I was just an assistant. So I was working on the front desk, and I was working as an aide in the back, just helping out. And so I would watch him do these splints all the time. And, they were also physical therapists in the clinic, but for whatever reason, I was just so drawn to him and like what he was doing and like all his techniques. And I loved it. So while trying to figure out what I wanted to do in college, I was like, why don't I do what I'm doing now? Be a therapist, because I loved it so much, and meeting new people and specifically getting to know them and seeing their progress was really neat.
Oh.
So that kind of led me to OT. And so once I hit OT, I was like, wow, there's so many settings. There's so many things to do as an occupational therapist. But I think honestly, hands were it was like my first love almost. And I couldn't get hands out of my mind. So I did an internship, and that was it. That's all. That's what I wanted to specialize in. So I decided to go to the hand route.
Fantastic. And you're working at Jubilee with Jen Sager, who is also one of my students who did the Sims course with me. What's that experience been like for you?
Oh, it's been wonderful. So I had, speaking to you a little bit about it, I had a hard time when I got out of school, because it's very hard to be the only hand therapist in a clinic. And that's very, very common here in the United States, here in North Carolina. And I got so lucky to meet Jen, and she took me on board to work for her. And she has been my mentor, and she's been able to help me through hard cases, and we've just fed off of each other, and it's been wonderful. I was also exposed to, the Sims casting through her, and she took your course, Robyn, and she started casting all her stiff hands, and then which led to flexor tendon repairs, which was phenomenal. But I learned the course through her. I ended up taking your course, which was so helpful. So it's been really great experience working with Jen. She's really seasoned. She's been a therapist for 20 years, all in hands. So she knows so much. And I love to just learn off of her and be able to, do this Sims technique now for my patients.
It is wonderful. It's a wonderful technique, and it is quite difficult to learn it, on your own, which is why we have the mentoring program. But to have a mentor physically there with you, who's also as passionate about the technique, I think that is really advantageous for you.
Yes, it has been great. It's been great. Even with the materials, that you're buying, and like how fast you're using them, or just little things on like how, how big or small to cut the pieces. We definitely learned a lot through your course, but then, with each other, we're like, wait, do you remember this about the course? And so we just kind of like feed off each other in that regard. So it has been very great.
So tell us a little bit about your presentation. What are you going to be talking about at the summit?
So at the summit, I'm going to be speaking on flexor tendon repairs, and how I've incorporated the Sims techniques on flexor repairs. Both Jen and I have. So it's been really a really, I would say in the beginning was a little scary, but we did it with the doctor's permission, and he was most of the doctors that we've used have been fully behind it. And so it's been really nice. But yes, I'm going to be speaking on flexor tendon repairs and Sims casting. So we've had great results. So I'm really excited to share how we've done it. I'm going to have a few case studies so you guys can see videos and things like that.
That's good, because there's new applications. The Sims technique is not just for the stiff hand. Through our Sims mentoring club, we're starting to establish that it's really good for nerve injuries as well as tendon and combined tendon and nerve. And this is a new avenue for research. Are you interested in research or documenting?
Yeah, absolutely. Jen has been talking about it as well. I mean, this is all so new. And there's not enough research on it. And that's the problem. And I think that could be the scariest part about it for a lot of therapists. I've had one of my friends actually reach out to me as well regarding, the Willant and, doing, early active, all of that is, even though it's been around for a little bit of time, I think it's fairly new to therapists and how you're rehabbing these new flexors and techniques. So it is a little intimidating, but I think that once you get the hang of it, everything works out well. And honestly, the Sims technique has been a great help to these flexor tendon repairs in a lot of different ways, So I think so far, we've had only maybe one that possibly might have a tenolysis in the so many of that we've done. And that's basically because the patient was not compliant with their program, unfortunately. But it works so well. It's great.
It's a game changer. And I think the best part about it is that it gives patients hope, particularly when they're not keen on having another operation. And you've got a surgeon who's on board. That is even better. Tell us about how you found working with Dr. Roulette and the Wallen technique and how that has helped you get better outcomes with your tendon patients combined with Sims.
Oh, it's absolutely game changing. And I say that because, you're able to move your patients right away. 3 to 5 days, they start moving. And you kind of see the progression as a therapist. Normally we see our patients about 3 times a week, occasionally more, depending on how stiff they are. But you really see the progression. And usually around 3 weeks, we've started. We used to start putting Sims on a little bit later, around 4 to 5, 6 weeks. And Dr. Roulette has been wonderful because he's very confident in his repairs, and he's very clear in his op notes. And though that makes such a difference, you can tell, at a certain point in his op reports, you could see where he wakes the patient up, they move, whether there's gapping, all of that you can see in the report. And I feel like I'm in the surgery room with him reading his report. So it's been really nice. And that gives us confidence as well. So we've been able to just feed off of that. And then we're like, okay, at this 3 weeks, we're like, okay, the hand is starting to get really stiff. It's not moving the way we'd like it to move, which doesn't happen all the time with Willant, which is really nice. But if it does, at 3 weeks, Dr. Roulette's okay with us putting him in a Sims cast. And we've gotten some great results early on, right? Because that's about that 21-day mark where all that scar tissue gets worse. So it's been great.
That is fantastic because, as you say, you're kind of reliving the surgery. And I think then as a team, you can do so well. And this is what the summit is about. It's about exposing practical solutions for patients. And unfortunately, Dr. Roulette's not showing us a tendon repair, he's showing us a CMC joint arthroplasty. But I think everybody will get to experience just how dynamic he is and how wonderful it is to learn from him.
Yes, actually, his arthroplasties are really great as well. We've seen a couple of those in our clinics. We have a couple now, and he does a great job with them. So that'll be really exciting for people to see those too.
Yeah. Well, thank you so much for sharing a few moments with us and letting us know more about you. And I think that you are in a fantastic position to just become a superb clinician, where when you're 20 years in, you'll be taking therapists under your wing, just as Jen is, and hopefully teaching Sims.
I hope so. I hope so.
So thank you so much. And we look forward to your lecture and the panel discussion.
You're welcome, Robyn. Thank you.